So our focus continues to do everything that we can to the best of our ability to make a difference for the next few weeks. To give you a case update then, we are going to be reporting, as I mentioned yesterday, the aggregate number of cases and cases by health authority breakdown, and we'll have those numbers for you. But we've had 83 new cases added to our database today, and I'll explain that in a minute, for a total number of cases of 186 here in British Columbia. 116 are in Vancouver Coastal Health Region, 47 in the Fraser Health Region, 12 are on Vancouver Island, 7 in the interior, and 4 in Northern Health. In addition, tragically, we have 3 new deaths reported today. 2 of them are associated with the ongoing outbreak at the Lynn Valley Care Centre, and 1 is a gentleman in his 80s in Fraser Health who passed away in hospital yesterday. In terms of total number of hospitalizations, we have 7 people who are in hospital, 4 of whom are in intensive care unit at this time. As you can see, the vast majority of the cases that we have are people who are being managed in isolation at home. In addition, we continue to have 5 cases who have recovered, although, as I have mentioned, we have many others who had very mild symptoms who have not yet met the criteria to be considered and are fully recovered. Today, in addition, we have taken the extra step of declaring a public health emergency in the province of British Columbia. This is something that, as you know, we've had as a tool in our toolkit for some time, and I felt that today was the tool. This is the tool that we need now. We've taken a number of unprecedented measures in the last few days, and this declaration of an emergency enables me to be faster, more streamlined, and nimble in the things that we need to do right now. To go back again to the numbers, and then I'll talk a little bit about, there's that's a large increase, and it really is not reflective of just the number of people who tested positive in the last 24 hours. As we've been talking in the last few days, we've had a dramatic increase in numbers of people going for testing and numbers of people being tested, as well as expansion of testing to 5 different sites in the province, and more are coming on board. So this is a reflection of a number of people who were identified in those other sites, particularly St. Paul's and VGH, where the testing was presumptive positive at those places and then had to come into the BC CDC for a second confirmatory test. So there was a delay in getting the second test and the confirmation, and the numbers then getting into our official provincial reconciliation, if you will. So in the meantime, the people who had tested positive over the last number of days from St. Paul's or from VGH were notified of that. Public Health was aware that these were presumptive positive, and the important actions to try and prevent transmission and to support people in isolation were all being taken. We are going to see that change over a period of time. So a big step up today as they tried to reconcile all these numbers. And there's a backlog of cases as well that we are managing over the next little while with that confirmatory testing at the BC CDC. So we're likely to see those numbers increase in the next few days as well. And this is in keeping with the testing strategy, our new testing strategy that we've moved to. And as we've always said, the first line of defense is testing. And as you know, we started with a strategy of testing broadly in the community because we needed to determine people coming in from other countries who were carrying this disease and could potentially spread it to others in our communities. We now know that all areas of the world really are at risk, and that this virus has been circulating in many areas around the world. So we've moved to the mitigation part of what of our response here in British Columbia. So that doesn't mean we're stopping testing or we're stopping our case in contact and contact tracing and containment piece. But part of our mitigation is for people who have traveled come back to Canada from anywhere, including the United States. We are now ensuring that they are all isolated and self-isolating at home for 14 days, so that if they develop symptoms and most people, of course, we know, have mild symptoms, they will not be transmitting it to others, and they will be in isolation at home. So for most of those people, there is no need for them to be tested unless their disease is severe or they look like they're either hospitalized or about to be hospitalized. So that is it's an expectation of everybody who comes in to the province, and we have issued an order on a class of people, which is just the legal way of saying that this is not, this is voluntary unless you don't do what we say, and then we have the ability to enforce an order on it. So it is something that we take very seriously and that we are willing to enforce if we need to. But our experience has been, with follow-up with most people, is they understand this. They understand the risk to themselves, to their families, and to their communities. And we've not had issues where people have been refusing to isolate or take the advice that they're given so far. So our testing, as you know, is now focused on clusters and outbreaks in the community that may not be related to travel, so that we're able to effectively and quickly manage those, as well as healthcare workers, our long-term care facility residents, and people who are hospitalized. The second line of defense that we're really focusing on, of course, is things that we're calling social distancing, and part of that is measures to reduce people who are going into healthcare facilities, trying to keep seniors protected, and staying away from others, the physical distancing part. And one of the most important parts of that is saying 1 to 2 meters from others. And we talked a bit about this when we put in measures around mass gatherings. So when we talk about 1 to 2 meters, we've been talking about arm's length, so fingertip to fingertip. And that's a good measure for people to think about in terms of what we mean by physical distancing. And we've been trying to do that too, to make sure that we're not, that we're showing you what we're looking at. So when we talk about a public health emergency and the social distancing and physical distancing, there are many places in our community that aren't able to meet those criteria under the order around mass gatherings and others. So, for example, bars and clubs, in my opinion, are not able to meet our test for social distancing and therefore must close. Restaurants and cafes, in some cases, can meet this criteria for physical distancing, but those who cannot maintain the physical distancing will need to close or to move to takeout and delivery services. So we're recommending that, and I know there's many innovative people who have been doing those sorts of things in the last few days, and I've seen that here in Victoria and other parts of BC. Those businesses and services that are remaining open, particularly the important ones that we need, that provide the daily life, the things that we need in our lives, like grocery stores and pharmacies, etc. And the other services that, such as public utilities and transportation, and keep our communities safe and provide essential goods and services, need to incorporate these distancing measures for workers and for customers. These are the tools that we have to build our firewall so that we are stopping that transmission between people in our communities and in our families. So there's 5 things that people should be doing today, really. Hand hygiene, we've always talked about. Cleaning our hands regularly, covering our mouth when we cough, not touching our face and eyes, and staying home when you're sick and staying away from others. Also want to say that right now with our testing strategy, we also have a new self-assessment tool. So because many people are at home, they have mild symptoms, and there's been a lot of concern about whether they need to be tested for COVID-19, we don't think most people do. What we need you to do when you're sick is to stay home and stay away from others until you're feeling better. And we have this self-assessment tool now that's at the BCCDC.ca website, and it had a soft launch last night, and we know that close to 500,000 people have looked at it already. So that's great. That gives you some advice on what to do and some reassurance. So you know when you're looking at that, what are the warning signs that you need to think about, and who does need and who doesn't need to be tested, and the fact that you can stay home and recover from this. We also want to talk again about protecting our most vulnerable people in our communities, particularly our seniors and elders. And we encourage all of them to stay home, stay away from others, stay away from crowds. And as a community, we need to come together to support those people in our community who need our assistance at this time. These are the steps that we're taking now. This is not forever, as I say, but it is for now. And these are the things that I need everybody in British Columbia to be aware of and to do now, so that in 2 weeks from now, we are not facing another crisis, that we're facing the ability to weather this storm together. And I want to finish by really telling us, you know, this is our time to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. I think Dr. Henry is right. Yesterday was a particularly somber day. We know many, many people, and I know many, many people who've waited a long time, for example, to get elective surgery because they're in pain, because they need it. They need it to function. It's critical to their ongoing life and participation in the life of the community. So when we announced, as we did yesterday, that thousands of procedures would be canceled, we know that that has consequences for people, and it's not a step we take lightly. And we understand the disappointment they may feel, and while they may well understand our decision, we understand what that means to people. Today, we had 3 more deaths to announce. 1 in the Fraser Health Authority, 2 more at the Lynn Valley Care Home. That's 7 so far from COVID-19. And we, as long as everyone else, grieve with those families. And this is truly another somber day for the same set of reasons. We have now 183 cases in British Columbia. Dr. Henry has explained some of the context of that. 116 of them in Vancouver Coastal Health, 47 in Fraser Health, 12 in Vancouver Island Health, 4 in the Northern Health Authority, and 7 in Interior Health. Of those cases, almost all of them are resting at home in self-isolation and continue to do so. Only 7 cases in British Columbia are in acute care. What we've seen, and I think Dr. Henry was speaking to this, in the last number of days, really since we last announced on Friday the number of tests that had been completed in British Columbia, we've seen a dramatic increase in testing, a doubling and then some of the total amount of testing in British Columbia, which represents extraordinary work. And that testing involves not just the now 5 sites that are processing tests across the province, but also the participation of Life Labs and others now that will continue to allow us to use tests to fight COVID-19 across the province. I want to thank again all the people that are involved in this process, all the people who, of course, get the samples, get the swabs, and all of the people who are performing in that who are performing so well under such difficult and challenging circumstances. One of the things we want to do, and we continue to try and do in this process, is empower people, allow them to be at home and to take care of themselves and to seek help when they need it. We recognize, and I think we've seen both through the dramatic increase in the use of 811, and we had another very significant day yesterday, although because of other tools we've introduced, the number of calls to 811 were reduced slightly, and the significant number of calls that we answer, more than 3,000 every day that are answered and completed calls, are a larger share of that now. 500,000 people already, 500,000 people have completed a self-assessment tool that we put up without fanfare and without even announcing, which indicates the extent of public interest. And so those are all significant things. We introduced, and Dr. Henry just announced, that we are using the powers under the Public Health Act to create a public health emergency. This is the second time under the current Public Health Act that has occurred. The first, as you may know, in 2016, in response to the overdose crisis. And just to give you a sense of what it means in practical terms, it means that the provincial health officer can issue verbal orders, we just heard some, with immediate effect. The provincial health officer can authorize health officers to perform their duties anywhere in the province, beyond the health authorities, the regions they work in. The provincial health officer can also compel any and all peace officers to enforce her verbal orders. In addition, it means that I, as health minister, can amend regulations without the consent of the cabinet, and the health minister can make changes to the Public Health Act without the consent of the legislature. We've seen today, as Dr. Henry has stated here, that clubs and entertainment and bars, which cannot maintain, in her view, social distancing, must close. That is an example of the use of her new authority. I wanted to say, in addition, what Dr. Henry said about restaurants, namely that they have to maintain social distancing, and that will be defined in regulation so people fully understand it, that those changes are obviously significant societal changes for people, but they are what are needed right now. And I think being clear about what's needed empowers people to do what they can for one another. There have been a number of questions as well about specific issues around supplies. We received a significant order of swabs today, and Dr. Henry described on Saturday how people at the BC CDC had repurposed swabs for use in support of COVID-19 testing in an imaginative and impressive way. We are soon to receive significant new shipments of masks, of N95 masks, which is of concern to a lot of people in the community and obviously in healthcare who are concerned with that, and we have adequate supplies well up to that time. We've also established community testing sites, or assessment sites, I should say, in all the regional health authorities, which are helping us as we dramatically increase the amount of testing we do in British Columbia. And we've just introduced the self-assessment tool. So I wanted to say just on behalf of the government how appreciative we are of health workers on the front lines who are dealing with these issues and are helping people now, and how much we appreciate and need the public to be involved in every way. Yes, to wash our hands regularly, to wash them often, to throw away Kleenexes, to not go to work when we're sick, to not leave when we're sick, to self-isolate when we're sick. These are critical things. To not visit, in particular, our elders when we are sick. These are things that we do. These are our duties to our communities. I think our duties to the ones we love and the ones we don't know. And so we're asking everyone to continue in this effort. I believe, and we believe, that we can continue by taking the steps we've taken, dramatic steps in the last couple of days. We can help prepare ourselves for the weeks and potentially the months to come. And that's why we're taking these steps, and we are very appreciative of the consequences they can have for people and what they mean for people. People not being able to do what they want in the course of a day, what they're free to do, what they've always done. Now that's going to change for many of us, especially the many, many people who have to self-isolate. It means a huge change. And of course, the change for our whole society and what it means for how we interact together. But I think we and people of BC, and we've seen this in the response over the last number of days, can do this together, can come together and do what we need to do as individuals to ensure and to slow down the spread of COVID-19, to contain it to the maximum possible degree, and we can do it for each other. And I think everyone in the healthcare system is committed to making that happen. We're happy to take your questions.
Okay, so we will start in the room. As a reminder, one question per person, please. And for those on the phone, press *1 to ask your question. We're going to start with Keith, Shannon, and Lisa.
Dr. Henry, so this big one-day jump, is this reflective, I think you sort of touched on this, is this reflective because there's more tests being done, so you're capturing this, rather than reflective of suddenly a giant, considerably expanded outbreak? And also, not a question, but a clarification. The order to bars, is that an order, and does it apply to all bars, no exceptions?
Yes, to the second, it is an order. And with regards to the first, it's more of a reconciliation of the numbers, and it's a reflection of a lot of testing that's been done. As you see, most of the cases are in Vancouver Coastal, and of course that's where we're dealing with the outbreaks at Lynn Valley, at Hollyburn, and in Lionsgate Hospital. So there has been quite a lot of testing. It's also reflective of people who've been tested in the emergency departments and the urgent and primary care center at Vancouver Coastal. So because that testing has a higher probability, and some of it didn't get into our numbers over the past few days just because everything has been so ramped up and sort of we thought it was increasing gradually, but then last Thursday, with the declaration of the pandemic and the measures that we introduced, it really went up quite dramatically. So it's a bit of time and reconciliation in getting the secondary testing that's done at the BC CDC. So that was the challenge. So I do expect we will see increased numbers over the next few days as well. But as I mentioned, these were people who were identified, public health action was taken, the outbreak pieces were all put together. It just wasn't reflected in the public numbers.
Sorry, Shannon.
Dr. Henry, can you just go over again the testing protocols that BC is following at the moment? I've had a few people reach out concerned about their own issues with being immunosuppressed or at higher risk. And a couple who said that they called 811, were told that they should be tested, and then showed up at a testing center and were told that the information they received wasn't accurate.
Okay, well, unfortunately, that can happen sometime, and I don't know any individual's situation, but we don't have widespread community spread of this virus yet, although that is something that, it's hard to know. But we do have some community cases, certainly. It's been a challenge in that if somebody doesn't have symptoms themselves, there's no need for them to be tested. And our strategy for testing has moved away because there were a lot of people who were presenting for testing who either didn't have symptoms and had traveled internationally and were well, but were being asked by employers and others to get tested. And of course, we know that if you don't have symptoms, that there's no reason to do a test. The test doesn't work, essentially. So we're also focusing the strategy on making sure that we can test those people where a case arises in a community, or there's a transmission that we're seeing in a community, and we're investigating that cluster and that outbreak, and we can be very nimble in being able to do that. But the other really key things are making sure that we can test healthcare workers, we can test the people that need to be within an outbreak, like we have at Lynn Valley, people who are hospitalized or about to be hospitalized. So for people who have mild illness, who've traveled outside the country, we know that there's quite a lot of people who may have been exposed to this in many other places, and that's the large volume of people who were looking to be tested. They either had very mild symptoms that resolved within a day or two, or were asymptomatic. And so we're saying you don't need to be tested, and now go to the self-assessment tool, and it can help support you. What you need to do is stay home and stay away from others. So we don't know if all of those people have COVID-19. Some of them will have influenza. Some of them will have other viruses. But the important thing is that they're taking the actions they need so that we're not passing it on to others.
Lisa.
Mine's sort of twofold about daycares. With knowing that these risks of seniors, number one, I think people have a hard time deciphering what a senior is, because people stay young. And so are people who are considered senior at daycares being told not to work there? I'm just wondering how people are being kept safe while the daycares stay open, and what exactly a senior is.
That's a good question, because my own parents were referred to as elderly, and they said, no, we're not elderly. We don't see ourselves as elderly at all, which I agree with. So who is a senior? We know demographically from the data that we have that people over the age of 80 are the ones who are most likely to have severe illness or to die from this disease. And that, from the Chinese data, from what we're seeing in Italy, bears true. But it also is much higher for people who have diabetes, who have chronic heart disease, chronic lung disease. So those are the things that we need to be careful of as well. So a senior, or a person most at risk, is defined by a combination of their underlying illnesses and their age. What we have seen here in BC is that people in our long-term care home are very susceptible to this. But we have had a number of people in their 80s and 90s who are living in the community, some of whom have traveled to other countries, including one that you know about who was in intensive care, but has now recovered and is at home. So it's not across the board. We know the risk increases after age 60 and 65, so technically seniors are mostly seen as over age 65, but it varies by person. So daycares are something that, last week when we announced the measures that we announced, we knew we had time because the schools were going off on March break, and I directed the ministry and worked with the ministry to develop a strategy that not only protects the staff and the students and the community of schools, but also supports particularly those students who are most in need in the school community. And I think they've done that, and we have a good plan for going forward. We're working in the same way for daycares to make sure that we can keep the daycare safe, that it's safe for the staff and the families and the children, but also that we can make sure that we have that essential service available for essential workers as well. So there is a strategy being worked out by the Ministry of MCFD and others to make sure that we can have a strategy that best protects people across the community. And that'll be coming in the coming days.
Mon, Fran, and Binder.
You referred to a backlog of tests that is not proven out 100 other in the process or still being assessed. And you also, I think, referred to the fact that there are a number of people out there who are self-isolating. There's no need to test them, but there's a number. So I was wondering, could you give us the comparative statistics? You had 183 positives out of how many tests? How many tests are in backlog that we still don't know about? And then how many people are out there isolated and haven't been tested and probably aren't going to be tested?
The short answer is I can't give you exact numbers for any of those things at the moment. So we do know that the number of people who have been tested in the last number of days in particular has been in the thousands a day. So we have a number of tests that are still in the backlog from that, but we also have tests that were done at the sites that were coming on board, and that's what's mostly reflected today. So the tests that were done at St. Paul's, for example, needed to have a second test done at BC CDC. They were called a presumptive positive until the lab had got into the place where they were validated, it's called in the lab speak. So initially we had the same thing with BC CDC. We called it a presumptive positive and we had to send it to Winnipeg, but we acted on it as if it was a positive. And that's the same with these. They were identified at one of the other labs and they were acted on, but they didn't make it into our reconciliation until it was confirmed at the BC CDC. So now all of the labs are doing it on their own, and we should be able to over the next little while. I also, there was a backlog, as we mentioned on Monday, yesterday, that particularly over the weekend, and we've now brought on new resources at Life Labs and others in the back office to help work through those tests. So they will be reconciled, I hope, by the end of this week, and we should have more stable numbers after that, particularly with our new testing strategy. In terms of the people who are out there self-isolating, it's in the hundreds, and I have no exact numbers. So these are anybody who has returned to British Columbia from outside Canada before, people who were out and came in after March 12th. So there's a large number of people. Most of them will not have COVID-19. Most of them are perfectly fine and they're healthy at home. But some of them will develop this over the course of the 14 days after their return. And if they have mild illness and they're at home, the purpose of us testing people with mild illness and the testing strategy we had early on was so that we could detect where people were coming from and be able to identify them when they come in and make sure they weren't passing it on to others. So right now, that's the key thing, is that anybody who's come from a cruise ship, who's come from the US, who's come from outside of British Columbia and outside of Canada, then they need to stay home for that 14 days regardless. And if they develop mild symptoms, they can take the online assessment and will help them work through how they can safely stay at home. If they develop more severe symptoms, then they need to call 811 and we can make sure that they get managed and assessed safely and tested if needed.
So from what you've said, the number of tests is in thousands. The number of people who are self-isolating without needing to be tested is in hundreds. The backlog is in the dozens.
It's probably in the hundreds right now, but it'll be reconciled over the next few days.
Thank you.
Friends.
My question is for the rural areas, particularly the north. You referenced it a little bit yesterday. The numbers are obviously still low, but increasing. Talked about doubling of testing, just wondered how those resources were applying to the north, how do people access that when they're in a very remote area?
So, and we do note that of the 4 cases in the north, at least 2 of them were actually tested and identified when they were staying in Vancouver Coastal and returned home. So yes, we've been actively trying to protect the north in many ways, because we do know that they have many small communities where this could be a serious issue in terms of getting into the community. So the testing is actually, it depends. There's some innovative ways of monitoring, so people who are at risk in different communities, if they develop symptoms, the management of individuals, it varies by community, to be honest. So it has been a challenge in terms of the testing gets done by a community clinician or a nurse, and then it does have to go down to the Lower Mainland or to Kelowna now too. So there's some workarounds that are happening to try and support testing in the north.
In terms of them accessing the testing, though?
Well, that can be done in the community by a healthcare provider. So that part hasn't been, it's more been getting the test into a lab that can do the test for it.
In there.
Hi, just wanted to ask, with Ottawa set to reveal some plans, financial support plans for Canadians tomorrow, just wondering how big a difference you think that's going to make in terms of convincing people the need to stay home if they feel sick. You know, if you expect more, you said that compliance is pretty good, and just wondering also what it feels like to have 2 public health emergencies going on at the time.
Yeah, that is a challenge, and for those who were around a few weeks ago, we released the numbers of people who have died from the overdose crises, and that is an ongoing crisis. It's not stopping because we have another one that we deal with, and you know, that's our challenge. It's not either or. We have to deal with both. And there are measures that are happening, particularly in some of the more affected communities in Vancouver, for example. There's a concerted effort to try and support the people in the downtown east side and other areas through both of these crises. In terms of the financial assistance, you know, I think across the board that's a challenge for people. We're shutting down lots of things, and people are worried. They're worried about how they're going to pay their bills, and so I think it's incredibly important to have that. We've been supporting people as well who have been isolated or quarantined for some time, and public health has been directly involved with many of those cases. I think it's very heartening that that's coming. It can't come fast enough. But I also think there's a realization that we're all in this together, and people do know that it is their close family and friends, the people that they're closest to, who are most at risk. So they're willing to take the activities, the actions that we've asked them to take. And we've also seen some really great things in our communities to support people. And we talked about the Chinese community in the beginning, the Iranian community, and the Persian community. But now we're seeing people support seniors so they don't have to go out to a crowded area, supporting people who are in isolation because of this. And I think we need more of that. We need to support each other through this because it's going to be weeks to come.
And just on this to say, it's very important, obviously. I don't think it's the critical question right now. But we're talking now about something that's going to be going on for weeks and months to come. So I think the issue around that is how do we deal with that term of things? So I think the cooperation has been extremely strong from people at this point. The financial pressure will come later, and it won't be pressure of having to leave. It'll be a pressure of needing support for the basics. And so we understand that's happening. Both, I think Minister James talked about that today, and the Premier talked about that earlier today here in British Columbia. And obviously there's a significant role for the federal government that's going to be needed to help everybody get through this, because there's COVID-19 and all the things we need to do. And I think people are up for that. I think they're going to be inspired by what Dr. Henry has asked them to do and what others have asked them to do and what the community is asking them to do. But where we need help is all those other things that continue on in life, bills and the need to live and to live in a home and all these other things that are going to put pressure on people over the next few months. And this is going to be, this is an unprecedented crisis. On the fact that there's 2 public health emergencies, absolutely, and there's been an enormous effort over years. They're different in the way they present, but they're both significant public health emergencies, and for people who are in some ways involved in both, they present real challenges that are also major challenges for the health system to address.
Okay, one more question in the room from Adrian, and then we will go to the phones.
A question for Dr. Henry. Regarding small communities that are seeing a dramatic increase in population because of tourism, like Tofino, there are concerns that the health infrastructure is not good enough to face an outbreak, and so there are calls, for example, to shut down hotel resorts in Tofino. Is it something you are considering to deter tourists from coming to these kinds of communities?
Not so much, mostly because we've been deterring tourists, and there's going to be restrictions on people who come into Canada that the government announced yesterday, and as well, we are actively discouraging our American friends to come in at this point because of the concerns around this virus. This is a time where we all need to work within our own communities. And I know Tofino has been isolated a few times this year because of the road construction, so challenges that they're facing there. We are not looking at this moment, although I do look at many of the resorts have closed. What is important is that they're able to maintain the physical and social distancing measures that we have required of businesses to continue to operate.
And regarding the resources available for communities that see tourists who are already coming and are not prevented from coming?
That's an issue that is going to slowly fade away over the coming weeks. And it's a challenge. Anybody who's come since the 12th who's been outside the country needs to be in isolation, and that may be in a hotel. And that presents its own challenges. I have not heard that that's an issue in any place yet, but it's something that we would be willing to support for sure.
Okay, we're going to go to the phones, and just a reminder, please, one question per person. We're going to start with Jane Side from the North Shore News. Go ahead.
Hello, Dr. Henry. I'm hoping that you can tell me a little bit more about the preparations that are underway at Lionsgate Hospital in terms of the special COVID critical care unit that you're setting up there. I'm sort of wondering if that's the first one or if you're setting it up at other places. And also I'm curious to know what the situation is in terms of patients who are at Lionsgate Hospital with COVID cases that are being treated right now.
Yeah, so I don't have all the details of that at hand today, but I can certainly get those for you. I know that there's measures that are being taken in a number of different hospitals in the acute care sector, and the ICU teams are working together to ensure that we have backup. And there's a strategy that looks at which are the key facilities that provide our tertiary level trauma care, for example, and how do we ensure we protect them so that they are able to provide care to people who have other urgent traumatic injuries or other needs. So it is part of a strategy. It is likely, depending on how this evolves, that we will have ICUs in other places as well. And so there are physical and administrative ways of separating off those units so that they only look after people who have COVID-19, and that other people in the facility, whether patients or staff, are protected. And there's mechanisms that we do, making sure people who work at one unit don't work on any other unit, making sure that they that there's physical barriers in place. And I know they're working that through right now. And we do know that people with COVID-19 have been treated in several hospitals around the province, and it can be done safely and effectively, and that's what we'll be managing at Lionsgate.
Okay, Gary Mason, Globe and Mail.
Hello, Dr. Henry. You referenced the announcement by the Prime Minister yesterday to close the border to international visitors, but exempting U.S. citizens. I'm wondering, obviously, the minister, Minister Dix, made his views known on this, that he wasn't in favor of it. I'm wondering if you could speak to it. Would you like to see the federal government revisit that decision and close the border to U.S. citizens? And if so, tell me why.
Yeah, so I don't think either of us think that we should be closing the border to U.S. citizens blanket. We have an interconnected economy. We have interconnected essential services and goods that move across our borders all the time. So our supply chains for our grocery stores, for retail stores, and some of the essential goods that we need now need to move across that border. What we are requesting, and what I agree with, is that the border be closed to visitors, people who are coming from the U.S. to visit in British Columbia, and I think that's a reasonable measure. We obviously don't want and can't keep out Canadians, and nor should we, or landed immigrants or others who have a residence here, but people who are just coming as tourists to visit, this is not the right time to do that.
And it's pretty straightforward. I mean, we're asking people who come here to self-isolate. It simply doesn't make sense to say people can enter the country as visitors and then self-isolate for 2 weeks. They shouldn't come as visitors, and this seems pretty straightforward. There are exemptions to other, if you look at the changes that have been made in travel from everywhere else in the world, essentially, there are exceptions to that, and we can do that in this case, but visitors shouldn't be coming here from the United States, from Washington State, especially given what's going on in Washington State right now and in King County in particular. This is just not a good idea. By the way, Canadians shouldn't go to the United States as visitors, and Americans shouldn't come here as visitors.
Richard Zisman, Global News.
Dr. Henry, I'm just wondering if there's a number for how many doctors and frontline first responders have been diagnosed with COVID-19. We're hearing some stories of first responders who are concerned that they have been infected when working with somebody who is one of the deceased now. And are you concerned about running out? Minister Dix mentioned a shortage of N95 masks. Is there a concern of shortages?
Yeah, so I'll address the shortages. What Minister Dix announced was that we don't have a shortage of respirators, N95 respirators. We do have sufficient supply now for what we need, and we have supplies coming in, both ones that we've ordered previously, but also as part of the national order that's been supported by the federal government. I do know that there have been a couple of exposure events, most recently a person who died in the Fraser Valley area, as well as we know, the outbreaks that we're investigating both at Lynn Valley, at Hollyburn, and in Lions Gate. And so those are all involving nurses, physicians, other people who were in the area in the room. And I know that there's a detailed investigation that's done in each person, and paramedics are part of that process. And they are very much part of our healthcare system, and they are notified if they've had an exposure to anybody who has been diagnosed with COVID-19. And I will also say that, you know, the standard of care, as we call it, for pre-hospital care, is that paramedics always should be wearing personal protective equipment that includes gloves and gowns and masks and eye protection whenever they are around people, picking up people who have respiratory illness or other illnesses. And we know that their job is very challenging in the community, and that it can be a very volatile or changing situation when they go into people's homes when people are sick. So the standard of care in pre-hospital is wearing an N95 respirator all the time. So that is something that does help protect them, even if they're transporting people with COVID-19 or other respiratory illnesses.
Okay, Matt Preprost, Alaska Highway News, go ahead.
Hi, Doctor. We're up here in Fort St. John, and as you know, the Site C project is right on our doorstep. Of the cases that have been confirmed in the Northern Health Authority, can you confirm whether any of those are at the Site C work camp, and what testing is being done there on site as well? Can you tell us what impact this public health emergency will have on the construction operations there?
Yeah, so I know that there's been a lot of concern about the work camp, and Northern Health has been working with the operators up there to ensure that all the appropriate precautions are put in place to support people to continue the work that they're doing up there. And again, under the terms of the emergency, there are very specific things about workplaces, making sure that you can maintain distances so that people in buildings, etc., are able to physically separate from each other, doing things remotely. So construction work outside is not as much of a risk that we're concerned about. Again, anybody who's sick should not be going to work, and making sure that the accommodations there are adequate to prevent transmission of infection is the most important thing that we're working with them on.
Megan Turcotto, Global Okanagan, go ahead.
Yes, just talking to a flight passenger who was on this flight from Vancouver to Kelowna on March 10th, where a fellow passenger has tested positive. And she says she has not heard directly from either the airline or a public health official, and that she found out secondhand about this concern. And so just looking for some more information about what your protocol is for notifying air passengers when there has been a positive COVID test on their flight, and this passenger is concerned that she hasn't heard from public health.
Yeah, so a couple of things, and we've walked through this before. It has changed a little bit. So we were notifying individuals who were in the seats around somebody who tested positive if they were symptomatic on the flight. And this flight was notified, WestJet put it out publicly that this was a flight where somebody had been identified. But public health was following up with the individuals who were at risk, for those who were within a period of rows around those people. So we were doing that for all international flights as well. It's a very challenging and cumbersome process. It's not easy. You actually don't show up as a name and a contact information on most flight manifests, so it's a matter of linking with things like passport information and other things. So it was a challenging process. We are no longer doing that for international flights. We're no longer doing it because we know that we are now, everybody who's come in an international flight has to be in self-isolation for 14 days. So finding them before they're out and about in the community is no longer an imperative. We will be posting those flights and posting things like cruise ship exposures as well on the BC CDC website and on the Health Canada, the Public Health Agency of Canada website. So some of those are up there. I believe this one was posted as well. The focus now is on the flights that are coming in internationally, starting, as I understand, this evening, will be diverted to certain airports. So east and west flights from Europe or from Asia will be coming into just YVR, Calgary, Toronto, and Montreal, and there will be additional screening measures of everybody coming in there as well. So hopefully we will not have this again where people are symptomatic on a domestic flight.
Vincent Plana, Daily Hive, go ahead.
Hi there, Doctor. While there are many companies that aren't able to work remotely, what are you doing to encourage employers that are able to allow their employees to work from home? It's being suggested, but there are many that aren't following through as quickly as needed.
So we do, this is part of it being an emergency and being able to put in some restrictions. So there are guidance that we have for businesses that if they are able to maintain those physical distances, and that may mean that people work at home on certain days, that they come in for certain spots, but not everybody's there at the same time. There are many different strategies people can use to try and reduce the number of people that are in that airspace and in that area, so that we reduce the possibility of somebody coming in sick and spreading it to others within that environment. And in my opinion, it's in most businesses' best interest to make sure that they have those in place, because the impact if somebody does come into your workplace and spread it to others could be so dramatic. Not only that somebody might have severe illness and end up in hospital, but also that people will have to be isolated, sent home and quarantined, and your entire business could be shut down, and they may pass it on to others, families and friends. So these are really important measures that everybody needs to take seriously right now, so that we can break these chains of transmission. We can stop transmission in our community in a broad way even if the risk is low right now, but it is changing. I shouldn't say the risk is low. The risk is changing, and we need to take these measures broadly across our community to try and make sure we don't transmit anything to others.
We have time for one more question on the phone. Gail Johnson, Yahoo News.
Thank you. Dr. Henry, we're hearing stories that suggest that it may be dangerous to take ibuprofen when you have the coronavirus. Is this something you can comment on, or is there any medications people should or should not be taking if they're at home recovering?
Yeah, I heard that. I haven't seen any good data to support it yet, but there was some a little bit on that, and we do have a clinical care group who are looking at these things. It would not, I mean, we have seen that with other febrile illnesses. Sometimes things like aspirin can cause a flare-up in people's immune systems, so it's biologically plausible, we would say, but I don't know the details of it yet. For treating fevers, ibuprofen is something that we use commonly, or plain Tylenol acetaminophen would be an alternative.
All right, that's all the time we have for today. Thank you, everyone.
Thank you.